आप सुन रहे हैं EBC रेडियो WWTR 1170 AM ब्रिज वाटर, आपकी चॉइस।
EBC रेडियो आपकी चॉइस।
Good afternoon, friends. You are listening to EBC Radio 1170 AM, Aapki Choice. And I'm your host, Alka. And as you know, whenever I come in the studio, I bring to you a very informative show with a very, very, very great speaker. So today is the time when we get to do our cancer education series, which is brought to you by Robert Wood Johnson, Barnabas Health, and Rutgers Cancer Institute of New Jersey. So today we are going to be talking on breast cancer. To speak on that, we have a very great speaker, Dr. Mridula George, MD, medical oncologist. Dr. Mridula George, MD, is the Associate Program Director for Breast Oncology and Medical Oncologist in the Breast Oncology Program at Rutgers Cancer Institute of New Jersey and Robert Wood Johnson Barnabas Health. Dr. George received her medical degree from Rutgers Robert Wood Johnson Medical School. She completed her hematology oncology fellowship at Rutgers Robert Wood Johnson Medical School and internal medicine residency at the University of Massachusetts. In addition to breast cancer clinical care, Dr. George conducts clinical trials which are providing cutting-edge therapies to breast cancer patients across New Jersey. In collaboration with pathologists, surgeons, radiologists, radiation oncologists, and nurses, she hopes to provide her patients with the most advanced breast cancer treatment options, including precision medicine and immunotherapy. With that, Dr. Mridula George, a very warm welcome on EBC Radio. How are you doing?
Thank you so much for having me. I'm doing well. Thank you, Alkaji.
Thank you for coming on airwaves of EBC Radio and sharing all your great knowledge, what you have been doing, and doing so many clinical researches where you're trying to bring more and more technology and science to treat cancer patients, right? Breast cancer especially.
Yes. We're working very hard at the Cancer Institute for treatment of breast cancer and also reducing the risk that this cancer comes back in women who have completed their treatment. And
this show, what we have been doing, Cancer Education Series, is more about educating our listeners to do early screening, hear their body, see their doctors, and find if there is any abnormalities happening in your body. You should be treated earlier than coming to know something in the later stage. Right.
Yeah, that's correct.
So again,
so breast cancer is very treatable if it's caught early. So It's very important to follow up with the doctors.
Exactly. So now let's get to some questions and let our listeners get more educated, specifically on breast cancer. So what are some common types of breast cancers, doctor?
So all breast cancers are not the same. One person's breast cancer is very different from the other person's breast cancer. There are three major features that we look when someone has a biopsy after they're found to have a breast mass. And on the biopsy specimen, we look at three markers: the estrogen receptor, progesterone receptor, HER2. Based on this, we are able to classify whether someone's tumor is sensitive to hormones, specifically the female hormones, estrogen and progesterone, or are they not sensitive. Tumors that are sensitive to estrogen hormones tend to be less aggressive than tumors that are not sensitive to estrogen hormones. And there are other subtypes specifically based on HER2. Mm-hmm. So when someone's diagnosed with breast cancer, they have a biopsy, they meet with the oncology team to understand what is their specific subtype of breast cancer. But the most common type of breast cancer is the type of cancer that is sensitive to the female hormones, estrogen or progesterone.
Okay. So now what are the symptoms? Like, how do you really know? Even you get your mammograms annually done and, there could be some family history or not. So, but how somebody would really think like, oh my God, I might be having a breast cancer. What kind of symptoms do they feel?
So most breast cancers, when women have a very early stage breast cancer, most women do not have any symptoms. That's the reason we strongly encourage getting screening mammograms. But in some instances, when the cancer has grown to a point where it can cause symptoms, some of the common symptoms include pain, or they can feel a mass. There's some distortion in the skin. They can see some dimpling in the skin. Pain, not very common. Then the other feature, again, not that common, is discharge from the nipple, either clear discharge or bloody discharge, changes in the color of the skin in the breast where the mass is. Those are some of the symptoms that women can notice, and that should be addressed with their doctor so that it can be further evaluated. So like I said, when it's very, very early, most breast cancers don't cause any symptoms in the breast.
So just curiosity, doctor, like say you get your mammograms done annually and suddenly something you feel, but your mammogram came out negative. So like negative in a sense is all good, So what are the chances, still you could see something within that year time that there is some cancer effect is happening?
So if there wasn't any symptom at the time of the mammogram, and then a couple of months later, someone's noticing a new mass, that is something to be addressed. I wouldn't just ignore it because someone had a negative or a normal mammogram.
Oh.
So sometimes even within a year of a normal mammogram, patients can develop some symptoms, and when we further investigate, we see some areas that was not previously seen on a mammogram that was done even within the 12 months.
Okay, so good to know that. So now how does, as we're talking about our community, the radio reaches to South Asians, so how does breast cancer impact the South Asian community?
So the incidence of breast cancer is increasing in the South Asian community, specifically in the U.S. There was a study done by one of my colleagues that looked at the cancer database here specifically in the U.S., looking at the incidence of breast cancer in Asian, Indian, and Pakistani women between 2000 and 2016. And when they looked at it, they noticed that South Asian women were getting diagnosed with breast cancer earlier compared to non-Hispanic white women. And the incidence of cancer from 2000 to 2016 was rising. And when women were being diagnosed, they were being diagnosed at a higher stage, or cancer having spread or become bigger than we would like, and also more aggressive subtypes of breast cancer. So the incidence of cancer is rising in South Asian women, but when they are treated, they respond very well to treatment. That's the reason we strongly encourage South Asian women to get screening mammograms. So if they do have a diagnosis of breast cancer, we're able to catch it early. And when it's caught early, the prognosis is very good.
Well, very good said, Dr. Mridula George. Friends, if you're listening to us, it is very highly recommended that you all must go and get your annual mammogram done and be very, listen to your body pretty much. After even you get your mammogram done, and we all have to be responsible for our own bodies. And we are talking to Dr. Mridula George, and we are grateful to Dr. Robert Wood Johnson Barnabas Health and Rutgers Cancer Institute of New Jersey for supporting this cancer education series. And so, Doctor, what should people know about breast cancer screening?
So the current guidelines recommend doing breast cancer screening, that is a mammogram, starting from age 40. So we recommend doing mammograms every year, starting from age 40. And this is for any woman that does not have a family history of breast cancer. If there is a family of breast cancer, then the recommendation is to start at least 10 years before the age that family member was diagnosed. And the family members usually first-degree relatives, mom, sisters, those are included in the first-degree relatives. So if they were diagnosed, say, in their late 40s, then that person needs to start with screening mammograms early on. And if patients have a family of breast cancer, we recommend following up in the high-risk clinic to see if there is a genetic mutation that would increase their risk, or to just get screening mammograms and MRIs. And there are high-risk breast clinics where at the Rutgers Cancer Institute, where we can order imaging for women who are at high risk for breast cancer.
Oh, so you're saying like a regular radiologist where you get your mammograms done. If you don't have a family history, the one who have a history, they should go to high risk place where they can be screened more deeper, I guess.
So on the high-risk clinic, they will look at the family history, try to see if anything else needs to be done besides the screening mammogram. There are women who have genetic mutations, and they already know their family member has that mutation. So those are women who could be seen in the high-risk clinic.
Okay. So now, doctor, tell me, what are the benefits of someone taking part in a breast cancer clinical trial?
So we're an NCI-designated cancer center, so we do have clinical trials. So when women are typically treated for breast cancer, we have a lot of drugs. And it's important to remember these drugs were FDA approved based on clinical trials that took place 10 or 5 years ago. And there were women who participated in the study. And in the study, it showed that the drug that was being studied in the clinical trial was better than the standard of care at that time. So by participating in clinical trials, you are indirectly helping women who could get diagnosed with cancer much later than you. So it would lead to an approval of a new drug. The benefit to the patient is that they could have access to some of the newer drugs that have better efficacy much early on before these drugs are approved. So that also helps someone by participating in breast cancer clinical trials.
All right. So I think, friends, you all must, if you get a chance to get involved in the clinical trial, you should participate so that this clinical trial places, they can collect a lot of data and it is going to help the future treatments. So it is very helpful to the researchers. So I think if you get chance, you must get involved into clinical trials, right, doctor?
Yes. No, I would strongly encourage. There are different clinical trials. Some trials open at different times. So and they close at different times depending on how many patients have entered into the trial. Mm-hmm. But I strongly recommend doing clinical trials if there is an opportunity, because you would have the opportunity to get a newer drug. So that's the biggest benefit for participating in the clinical trial. One thing that patients worry when taking part in a clinical trial is that, am I not going to get a medication? Most of the cancer trials where we're trying to treat the cancer, they still get the standard treatment, which is the treatment, and the treatment arm is going to get the new drug. So most clinical trials that we have, we don't give placebo or a salt tablet or just IV fluid. So that's something that is a misconception that most people have. But if there are questions or you have any concerns about participating in the clinical trial, do talk to your doctor, and they are able to answer any questions you have. And once you sign for a clinical trial, you can always withdraw the consent if you're having really bad side effects of the clinical trial. Mm-hmm. It doesn't mean you have to continue on that trial in spite of having the side effects.
Okay. Good to know that. So now, doctor, tell me, what is the benefit of receiving this type of care at a National Cancer Institute designated comprehensive cancer center like Rutgers Cancer Institute and Robert Wood Johnson Barnabas Health?
And to become an NCI designated cancer center, there are very strict criteria that needs to be met, and there are 52 centers across the country that are NCI designated, and Rutgers Cancer Institute of New Jersey is the only NCI designated comprehensive cancer center here in New Jersey. So by getting care at the Rutgers Cancer Institute or RWJ Barnabas Health, you can be assured that you're going to get the best care in the state. There are social workers to help manage symptoms or difficulties that you may have, especially while going through treatment. Breast cancer is a very scary diagnosis. it impacts not only the person who's diagnosed with cancer, but also impacts their family, their work. So we have social workers to help navigate through different situations. There are navigators that help patients get the right care. They make sure that they get the right appointments to see the right doctors during this journey with breast cancer. And then we have the addition of clinical trials. And the other thing is when you receive care at NCI-designated cancer center, we have tumor board presentations where the patient's cancer is being presented and discussed as a group, not with just one medical oncologist, multiple medical oncologists, surgical oncologists, radiation oncologists, and radiologists who are involved in the care of the patient.
Okay, so that's really good. Everything is in one place and the patient doesn't need to run from one hospital to another doctor's or, other care place. Everything is in one place and they navigate you through the whole process.
Correct, yeah.
All right. So, Doctor, now we're almost towards the end of our show. Again, I want to thank Robert Wood Johnson Barnabas Health and Rutgers Cancer Institute of New Jersey for supporting this amazing cancer education series. So, can you give us some tip how to prevent getting breast cancer?
So healthy lifestyle is very important, not just for breast cancer, but for other cancers as well. Physical exercise is helpful. There are studies that have shown that regular physical activity and maintaining a healthy body weight is helpful. Avoid smoking. Because that increases not just the risk of breast cancer, but breast or lung cancer, but all other cancers. Then make sure you don't drink too much alcohol. So keeping an eye on the alcohol intake, then healthy dietary intake. Those are all steps that we can all do to prevent, to reduce the risk of breast cancer.
It is so amazing. It's such a simple thing we all have to do, but we have to make our brains understand that exercise, eat healthy. These are the two very, very important things for every kind of disease or every kind of, to prevent to get unhealthy. I think these are the two things if you maintain in your life, I think you will be a healthy person.
Yes, that's true. Not just for cancer, but also cardiovascular diseases as well.
Right. I do so many shows and every doctor I ask this question, these are the two things they talk, exercise and eat healthy. So thank you so much, doctor, for giving us such a great information. And friends, if you want more information about Rutgers Cancer Institute of New Jersey in partnership with Robert Wood Johnson Barnabas Health, you can visit rwjbh.org/beat cancer. rwjbh.org/beat cancer. So, doctor, any last words you want to say before we close the show?
No, breast cancer is a scary diagnosis, but we have very good treatments, especially when it's diagnosed early. So if there are any symptoms of breast cancer, please do not ignore it. Please talk to your doctors and seek appropriate care. And the Oncology Access Center is able to guide patients to find the right doctors, especially in the field of oncology. So do not ignore any symptoms or any early signs that there might be something going on. It's better to be treated early than waiting till the symptoms get worse.
All right.
Thank you so much for having me on the show.
Thank you so much for sharing your knowledge and your work, what you do. And we are very grateful for that. And thanks again and looking forward to speaking to you more.
Likewise. Thank you.
Thank you.
Bye.